Welcome to our webinar describing how to collect dried blood spot cards from a finger stick. I am Kelli Goodman, Principal Scientist at Metabolon.
And my name is Blair Lane, Research Scientist at Metabolon. First, lay out all materials you will need for collection. Open the supplies as shown so they are ready to use before lancing your finger. The gauze is used twice, once at the start of collection and once after collection. One lancet is required, but we recommend a backup in case an additional finger stick is needed. The front flap of the collection card should be open and tucked behind the sample collection circles. It is important to have good blood flow to the fingertips. Here are examples of what we've seen works well. Drink plenty of water prior to the collection to help with blood flow. Warm the puncture site by submerging your hand in a glass of warm water or hold a hand warmer. Use the windmill technique as demonstrated to increase blood flow to the fingertips. Gently massage the hand from palm to fingertip. Ensure you are using a high flow lancet.
And during collection, here are some examples of how to maintain the blood flow after puncture. We recommend standing, as this helps keep the hand lower than the heart. You can gently massage the hand from palm to fingertip, but do not press firmly on the fingertip. And when blood flow slows, you can wipe off the coagulated blood to allow a fresh droplet to form. Now, it's very important to stop and allow a large droplet to form on the finger before attempting to spot on the card. The droplet is large enough when it is close to falling off the finger. Hover your finger over the collection area and let the droplet fall freely to the circle, or you can carefully touch the blood droplet to the card, but do not touch the finger directly to the card. Hold there for a few seconds so that a large enough circle is collected. If the spot appears too small, move on to the next spot, as you only want to collect one droplet per spot. If the blood flow slows, you can wipe off that coagulated droplet and allow fresh blood to flow, or you may need to lance a different finger. Collect all 5 spots if possible. We only need 2 per analysis, but we prefer to have backup. Once all 5 are collected, stop the blood flow with gauze and apply a bandage.
Here are what your samples should look like to receive the best quality data. They should appear dark reddish brown to indicate that they are fully dry. 6mm punches will be taken from 2 spots for analysis, so the spot should be as large as the sample shown above.
And here are some examples of what we consider invalid specimens or poorly collected ones. For example, if they are bright red, that indicates that they have not fully dried before freezing, or if they appear smeared, that could be due to the alcohol not being completely dry, or the fingertip was squeezed too much.
Thank you very much for your time.
For additional questions, please reach out to us or a Metabolon representative.